This is Jerry Hesch of the Hesch Institute in Aurora, Colorado, and I like filming interesting presentations. And my friend Anthony asked me to look at his foot. He's a massage therapist, body worker, exceptional clinician who works in San Francisco. And can you describe to us why you wanted me to look at your right foot?
I feel some tension.
Speak loud, speak loud.
I feel some tension and like I don't feel comfortable, like a range of motion, and I just want to see if it's from the muscle or if it's something more like a joint related.
Very good, very good. What's unique about his presentation is that the rear foot has very little motion. So when I try and get calcaneal motion, what I'm trying to do now is evert his calcaneus, and it's incredibly tight. I can just get the tiniest amount of movement in that joint, and then motion is locked, and I'm pushing laterally while I stabilize tibia and fibula, and I put a moderate amount of force and there's no movement. The other movement is a twisting movement in the subtalar joint. I allow ankle motion, so I'm not squeezing. If I squeeze the lateral and medial malleolus, then this would only move in the subtalar. But I leave it unrestricted, and I allow motion to happen also in the ankle joint, also called talocrural joint. And so now I twist, and there is so little movement, and there's no additional rotation available. On his left foot, I can push his calcaneus, and there's a little bit of give when I push it laterally. Okay, little bit of eversion, and so it moves, and then it gets to a stop point, but then I can spring it and I can get additional movement. Okay, now I'm going to twist the back of the heel to the right medially, so the front of the calcaneus would go outward and the foot would go outward, and you can see considerably more movement. And so I rotate the foot outward to an end point, and then I can overpressure it. And a normal joint will have a normal little bit of give, but it'll be strong. And so he has normal mobility on the left side. What's interesting about this presentation is that usually when there's a lack of subtalar eversion, a lack of subtalar abduction, usually the whole foot gets tight. And the whole foot ends up being rigid and held in a supinatory pattern. And usually the midfoot, just relax, usually the midfoot lacks pronation mobility, but he moves beautifully in the midfoot. And oftentimes the fibula will get stuck inferiorly. He's got beautiful fibular mobility. He's got normal spring posteriorly of the lateral malleolus, normal anterior spring. I go up to the back of the fibular head and I spring that forward. He has normal motion there. And I come and I isolate the cuboid and I test up and down mobility of the cuboid, and that's all normal. So anyway, I'm going to treat it. Let's have you lie on your stomach, please, and let your feet overhang the table. Scoot up just a little bit. Okay, good, good. So the way that I restore motion to the subtalar joint is I distract the heel, and I maintain that distraction firmly for, say 10 seconds. And by distracting it, it then allows me to get some abduction. I also call that movement external rotation. And the secret is to restore the rotation. I've seen a lot of demonstrations where mobilization is done just to evert the heel. Well, you can only get so much movement in that direction. You have to distract the joint, and then you can get a little bit of eversion, as I can feel a little bit of give, but really there's a much greater rotational range of motion, and so when you restore the rotational range of motion, the eversion follows. So I endorse mobilizing the calcaneus in rotation, also called abduction, instead of mobilizing it into eversion. Okay, so I like to oscillate this 30 times. Okay, so now lay on your back. We'll test it in the same position as we did before. So you were laying on your back, and what we found was that you didn't have any eversion mobility, and now I can evert it a little bit, and I can now overpressure it and take it a little bit further. And I can now abduct the foot, and it rotates outward, and I can overpressure that and get more external rotation. Okay, the self-treatment for him to keep that motion is every day for a week. I want you to do this exercise 30 times, and then I want you to do it once a week forever. Okay? Let me check my camera angle. And that is your right foot. So you're going to stand, and you're going to turn your left foot outward and twist your pelvis to the left. Okay? And then you're going to do little tiny pelvic rotations to the left. And I want you to feel the foot flatten, and I want you to feel the heel evert. Okay, you want to feel that heel motion. And you do this very gently and slowly. I don't want you to stress your knee. Okay? I'd like you to feel a straight line through your heel, through your ankle, through your knee, through your hip, and through your shoulder. And don't change that angle, okay? And then just do 30 little rotations of the pelvis to the left with your left foot pointed outward. 30 of those, okay?
Thank you.
But let's have you walk down the hall and come back and tell me how you feel.
Yeah, I feel much more free.
Much more free?
Yeah, much more free. Like I don't feel this tension like before that.
Nice.
Yeah.
Good, good. Okay, so go stand on the
Thank you
wood
so much.
part of the floor. Yep. So good. So you're going to do this once a day for a week, and then once a week for forever. All right.
From this,
So point your left foot outward.
like,
Point your left foot outward.
should I stay here and here?
Yeah, like that. Perfect. Perfect. Good. Now imagine a line going through your right ankle, your right knee, your right hip, all the way up to your shoulder. And now twist your pelvis to the left. Good. I don't want your right knee to bend. You're not bending your knee, are you?
No.
Good. Okay, good. So do 30 little stretches at the very end of the range. Good. Little tiny twists of your pelvis. Do you feel the foot flattening?
Yes.
And you feel the heel moving?
Yes.
Perfect. That's it.
Thank you.
So give me 30 right now and I'll stop filming. And interesting that the rest of your foot, the midfoot did not tighten up, and that's pretty rare. So thanks for letting me film
Thank
this.
you.